Liposuction begins with a doctor inserting a small hollow tube through tiny incisions in your stomach. It's then placed into the fat beneath your skin.
I find this to be a little inaccurate. First of all, where that's placed, it's done in hidden areas. And that incision looks massive. The normal incision for liposuction is basically the width of my pinky.
Now, this tube is connected to a vacuum, and this vacuum literally suctions out the fat in the area you want it removed. As it's being sucked out, a doctor will use an instrument to break up the fat cells to make sure it's being sucked out evenly.
It doesn't really explain a lot of things. It's very basic. The graphics are okay. Safe lipo is the best form of liposuction, where basically we do the separation, aspiration, and then fat equalization. That gives an amazing, smoother result and the best skin shrinkage.
If you somehow removed all of the blood vessels in your body and tied them together, you might think it would be about this long. But the human body has thousands of these tiny vessels that weave in and out of every body part. And with all of them combined, if you started in New York, your blood vessels would make it all the way to the Grand Canyon. It would go on to reach all the way across the Pacific Ocean, over Japan, Asia, and all of Europe. And not only would it make it all the way back to your starting point, but it would be able to make this trip 2 to 4 times over.
Really hard to believe that it's that long, 2 or 3 times around the world? I don't think so. I think you do have thousands of blood vessels in your body and it can go a long way. I'll be honest, I'm not sure how long it will be, but there's no way it's 2 or 3 times around the world. Sorry.
If you get a really bad burn, a doctor will scrape off all of the dead, damaged skin. Then they will cut off a piece of healthy skin from another part of your body.
They mix this up a little bit. This video shows like a full thickness skin removal of the lower back. That's not how it's done. Actually, that thing when you scrape off is actually dermatome, which helps you get partial thickness of the skin graft. So then that partial thickness skin graft is placed over the burnt skin that's removed and stitched in. So this video doesn't explain how the donor site is closed. And so that's my explanation. Partial thickness graft, the skin grows in from deeper areas.
If you get a splinter, most people just go ahead and pull them out. But sometimes they get lodged so deep into your skin that you can't reach them.
This is true. This can also be very, very painful.
If the area gets infected, it will start to swell as pus forms under the skin. This creates pressure around the splinter.
If it gets infected and causes this problem, it's going to hurt even more. You would know something's there. You have redness and a lot of pain.
That can sometimes push it upwards towards the skin's surface. And if you're lucky, after a certain period of time, your body could have completely removed it from your skin.
Usually they're not infected and you really can't feel them. Sometimes you have to try and dig them out with a little bit of an 18 gauge needle or a 25 gauge needle, which is possible. And occasionally the body just pushes it out altogether. But these that are very sensitive in the feet and fingers can be very painful and you can feel them all the time.
When you get stitches, a doctor threads a needle through your wound and pulls it tight to close the skin. As the stitches hold the edges together, the wound becomes inflamed as new cells begin to repair the tissue.
A plastic surgeon does not do it this way. First of all, we put stitches in multiple layers underneath the skin, and then we put the stitches in the superficial layer of the skin. The problem with doing baseball stitches like this is that leave train track marks, which leads to more scarring.
Afterwards, connective tissues and collagens start to create skin. Then, blood vessels form to nourish these developing tissues, filling in the area. And over a few weeks, the wound will have healed together and the stitches are removed.
For demonstration purposes, a lot of this is true, but they're leaving the wound wide. You leave a wound wide like that, you're gonna have a thick, ugly scar. These are the way surgeons of other specialties close wounds with stitches, but not plastic surgeons. We're better than that.
If you get really fat really fast, your skin struggles to keep up with the rapid expansion. The middle layer, called the dermis, starts to tear under this sudden pressure. This allows the deeper layers of skin to show through, creating visible streaks.
This can happen, yes, it's true. It also happens to women in pregnancy, and also some teenagers where they have these crazy growth spurts. They can actually stretch out their skin because their skin's not growing as fast as their bones and muscles.
At first, these marks are red or purple due to the blood vessels beneath the skin, but over time the color will fade some and form scar tissue. This causes the stretch marks to become a permanent, natural tattoo that you never asked for.
Basically, stretch marks do cause scars, which never go away. There are creams, lasers, none of that. They make minimal difference.
If you break your leg while hiking, most people would try
That's really painful.
to hobble back to safety. But this can cause more damage to your leg. Instead, you should stay put and use a stick and a piece of clothing to create a splint.
You never want to put pressure on a broken leg. You always want to splint it. You could find another stick as maybe a crutch, so you could hop along back to safety. You always want to hike with another person, so that way if this unfortunately happens, that person can at least go for help and get help quicker to you.
He stuck a Lego piece up his nose, and it got stuck. So he shoved a different piece in the same nostril because they connected together, and he thought it was a smart way to remove it. But instead, both pieces ended up getting stuck. His mother pulled out the bigger piece, unaware that the smaller one remained deeply lodged inside.
This is a rare story, but very possible. But if any foreign object gets stuck up your nose and you get it out with a tweezer, okay, she was very gentle, she didn't cause any damage, but she really should have her child evaluated by a doctor to make sure everything's okay and there was no damage formed.
For 26 years, he struggled with congestion, asthma, and sleep apnea without realizing why. Then, one day, while blowing his nose in the shower, the Lego piece suddenly popped out after 26 years.
It's hard to believe it didn't cause him more problems than that. Sometimes it can cause chronic infections, erode through the tissues of the nose, causing severe problems.
He milked the venom from the snake before injecting it into his veins. But it was such a small amount that he was unharmed, and this allowed him to build up antibodies.
This is extremely dangerous. Do not try this at home.
Over the next 20 years, he did this 700 times, injecting more and more venom. And eventually, he built up a tolerance. He's now been bitten over 200 times by some of the world's most deadly snakes, and he's survived each one. Eventually, his blood could be used to create a universal antivenom, saving people from all kinds of snake bites.
So there are actually two guys who did this. Their names were Tim Fried and Steve Ludwin. And their goal was to create basically a serum or antivenom instead of ones that we have that are horse-based. Basically, these guys did not die from this. Fried survived almost 200 snake bites and about 650 self-injections. He even survived a cobra bite, which temporarily left him paralyzed. His blood has been instrumental in potential new antivenom.
When you pick your nose, your fingernail scratches the delicate skin inside. Now, this lining is full of tiny blood vessels.
Sometimes there's a plexus there called Kesselbach's plexus. Some people are more exposed to this, and when you pick your nose a little bit, you can get a lot of nosebleeds,
which can easily get damaged. If you keep picking, you can make small cuts that don't heal properly.
To cause this effect, you have to do a lot of picking, like every day kind of stuff.
If the damage gets bad enough, it can create a hole.
If you get blood on the cartilage area, it can weaken the cartilage, warp it and weaken it, and can cause a hole.
This hole can make it hard to breathe and can cause nosebleeds, sometimes requiring a surgery.
Sometimes you can't breathe well, and so surgery is required to fix that.